Hello everybody, welcome to our, it's the 13th School Health Research Network webinar. So for those of you who don't know, my name's Joan Roberts and I manage the network. It's the second webinar this academic year, and we share in our webinars the learning from network research around the role of support, and today it's about the role of support staff alongside teachers in school health and wellbeing. All the other webinars we've done are actually on our website, shern.org.uk, if you would like to catch up with any of those. So just before I introduce Hannah, who's going to lead this webinar, I just want to say that if you've joined us on computers, laptops, then you'll be able to see this presentation. If you're on the phone, if you email shern@cardiff.ac.uk, Gillian will send you the slides so you can be following as you go, because I know that some people swap to a phone because they have difficulty joining us. And just so that to let you know who's with us, we've got healthy school practitioners alongside our school links, and then a few National Quality Award verifiers. So that's who the audience is. So just to say, if you haven't joined a webinar before, you'll notice on the left-hand side there's a banner entitled Chat. And if you can type any thought or query you have as it occurs to you, and then I can ask those as the time seems appropriate. So thank you for that. So on to the main event. So Hannah has very kindly said that she'll present this webinar. Hannah's done a couple for us. She's very kind. She started her PhD at the same time as our network was formed, and so she's been very supportive of us in that time. But more importantly, just to say that she's literally just come back from maternity leave, so less than 2 weeks ago. So we are doubling in gratitude for her doing that. So thank you, Hannah, and it's over to you. I'll just move on to get to your slides. So thank you.
Thank you very much. Hi everybody, thanks for the introduction, Joan. Today I'm going to present to you some research that I've just had published from my PhD, which I finished in 2016. So it was actually published whilst I was on maternity leave, which was great. So we're going to be looking at the role of support staff alongside teaching staff in supporting secondary school health and wellbeing. So during this presentation, we'll start with previous research and have a look at that, and then we'll move on to what did I do within the research and what did we find, and then we'll look at conclusions. How does this research impact you as school practitioners? So previous studies looking at the school environment have shown that actually a positive school environment is really important for improving students' well-being. And it's been shown to be linked to increased pupil engagement with school and improved relationships between students and staff, and actually health outcomes such as reduced drug use. And these kind of studies have defined the school environment as things such as the provision of teaching and pastoral support within schools, the number and types of policies available, and the characteristics of the school building and grounds. And so obviously today that's really relevant as we'll be focusing on the provision of pastoral support. And so there's been quite a bit of research on the student-teacher relationship, and actually a positive student-teacher relationship has been consistently shown to predict health and wellbeing outcomes among pupils. But the problem with this is that obviously teachers have a high workload. They don't necessarily have the time that they would like to sit down with pupils and discuss health and wellbeing issues in depth. And they also have immense pressure to focus on educational attainment and meet targets. And there's also some research looking at the power imbalance within this relationship. So teachers are seen as powerful within that dynamic, and maybe that's not quite so conducive to talking about wellbeing issues and building rapport. And also, studies have generally tended to reduce school staff to teachers within their research. So they've really just focused on teachers within school rather than support staff. So that's why we decided to conduct this study. So our definition of support staff includes all members of staff who are not teachers. So this includes teaching assistants, ICT and lab technicians, school nurse or medical staff, pastoral support staff such as ALSAs, or SEN support staff, and foreign language assistants, among others. So what did we aim to do within this study? So the main aim was to understand the role of support staff in promoting health and wellbeing. And so I really wanted to understand how this role of support staff differed from teaching staff and previous findings, and also to look at what was the impact of having both, of having a team of people looking at pastoral support, and how do they work together to promote health and wellbeing. So what did we do? Well, firstly, we recruited 4 case study schools, and we tried to get kind of a representation of different locations, such as rural and those in the city, different sizes of schools, and different socioeconomic status. Once we'd recruited them, we then conducted interviews within these 4 different schools, and that included 4 to 5 interviews with different members of staff. And these were staff such as head teachers, teachers, and support staff. And there was one Healthy Schools coordinator as well. I also conducted interviews with parents. So there were 1 to 4 parents per school. Obviously, it's very difficult to engage parents. So in a couple of schools, this comprised of parents who actually also worked in the school. So that was a pragmatic decision in the fact that it was so difficult to actually access parents through schools. And finally, we interviewed students. So we did 3 to 5 paired interviews with students per school. So what did we find within these interviews? So the first theme I'm going to talk about is the interacting roles of teaching and support staff. So findings showed that rapport between staff and students was really important in students' decisions to approach teaching staff. So the extent to which teaching staff were viewed as approachable really varied by school and by members of staff as well. So a quote from 2 Year 9 girls said, "Yeah, I think you can go to whoever you feel comfortable with. So if you're more comfortable with one teacher, you can go to them instead of somebody else." A different school, again Year 9 girls, said that so teachers caring about the students makes them want to learn more, because you've got a teacher who dislikes you, they dislike you, you're not going to want to be friends with them. Further to this, the fact where there were teams of support staff, and this was really perceived by staff to increase, because teachers were perceived to be extremely busy. So a quote from the wellbeing lead in one of the schools, obviously these aren't the real names of the schools, said you have to have that solid team for it to work in every school, really. Obviously, if you haven't got that type of team, then it's really hard for that teaching member of staff, time-wise, to be able to address all those type of issues. So this particular school had a really comprehensive team of wellbeing and pastoral staff who worked closely with teachers, and their wellbeing lead was a deputy head. So it really worked well in that they had lots of manpower to be able to address these issues, but they also had someone within management to be able to make changes within the school. And further to this, then, the provision of physical space was seen as important by students. So physical space enables there to be somewhere for students to go to. If they know that support staff is going to be there all the time, they know that they can where they can go for confidential advice. So, for example, these Year 8 girls said you could go up to C floor. That's where the pastoral support officer and another pastoral support officer's office is, and one of them are always there. So they know that they have that support in the background. Time and space was also seen to be important for support by teaching staff. So as well as having that time and space provided for support staff to provide advice, this particular school provided that through teaching staff. So within break times, they had the head of year in their office, and the pupils were all aware of that. So they knew that they could approach their head of year and nip any problems in the bud as they happened, as you can see by the quote there. So moving on then, there were also findings that showed, although it was important for teaching and non-teaching staff to be available to pupils and approachable for pupils, there was also a unique role of support staff that was different from that of teaching staff. So findings showed that actually status as a non-teacher was particularly important to pupils, and this was particularly important for low SES schools. And the non-teachers or support staff were really shown to be able to know personal details of students and have the time to get to know them properly and to identify problems. They had more capacity for one-to-one advice and help, and they were perceived to be able to refer to outside agencies and get the help that was needed. And also pupils showed that perceived it to be important for these people who were going to help them to be perceived as specialists in their area. So a maths teacher may be not seen as a specialist of well-being, whereas a pastoral support officer may be perceived as someone who will be able to help them with that particular problem.
That's quite interesting then, so that they're approachable, but actually in the young person's mind, they know that they could, that their role is to sort of help them in quite specifically. So it's quite interesting.
Yeah.
Point now.
So here are some quotes to support that. So a PE teacher in one of the schools said, "I think if you're in the pastoral team, you're more aware of their background, their family life, their health, their situation. You get to know if they're eating properly." A wellbeing lead from another school said, "Having individual staff who have the personal attention to detail with each child so that they can involve the multi-agencies that are required to make sure that person, is safe and certainly looked after within the family and school, and in the school is important." So that was in a more deprived school. So it really came across that more deprived schools had more kind of provision wellbeing.
Yeah, that's quite interesting, because in primary schools as well, they would probably have more support staff. Do you know has any research sort of supported? I don't know if you've read any research in primary schools on that.
I haven't, but I think it would be really interesting.
Yeah, no, it would,
interesting area.
There's more, they tend, because of the age of the children, there's more support staff.
And it would be really interesting in terms of, because the teacher is spending the whole day with the child, I guess they have more time to develop a closer relationship with each child.
Yeah, no, interesting study.
A further finding was about the school nurses. So in one of the case study schools, they had a kind of unique setup in that their school nurse was full-time, and they were there every day and available with a physical space, physical office for students to approach. And this really came across as something that transformed wellbeing within their school. So the physical space, the physical office for pupils to approach was seen to be really important, and their capacity for one-to-one compared to the normal setup whereby school nurses go into schools maybe 1 or 2 days a week for a few hours. It was really came across strongly that this was something key to wellbeing within their school. They were also seen, the school nurse was also seen as excellent for engaging parents within the school and any issues that individual pupils had, and for referring to outside agencies. So a quote from one Year 7 and Year 11 boy says, the school nurse, deals with it herself 99% of the time. She won't tell anyone else our problems, she'll keep it to herself, unless it's really bad, and then she'll just tell our head of year. So that trust and rapport and feeling confidentiality seem to be really important. So to summarise the results then, time and space to deal with wellbeing in a one-to-one setting was really the main message, and having a team of support staff that work alongside teachers was seen to facilitate that. And another main kind of message was that students felt it important to have the choice of approaching teaching and support staff. So previously, the good relationships within the school had been shown to relate to student satisfaction with schools, student connectedness to school, and subsequently their health and wellbeing outcomes. So this really shows that the findings within the study show that actually having support staff within a school is really important for breaking down barriers between staff and students and improving relationships and subsequently wellbeing. So from this, we can look at the areas for further research. So in this study, we looked at perceptions of accessibility and knowledge of what staff were available to approach. I think a really interesting area for further research would be looking at the quality of these staff. Have they had any particular training, etc. And also, the findings showed that actually lower socioeconomic status schools had better provision. So we need to really look in the future about what this means for more deprived pupils or students in more affluent schools. Are we missing those? And finally, the role of the school nurse, I think, warrants further research, because that was such an interesting finding. I think that would be something to pursue. So obviously, I feel like this was a high quality piece of research, but you also always need to be mindful of the limitations of each piece of work. So with this, the sampling was pragmatic. We approached schools who we thought would be representative, and some did not want to participate, so we had to then make the decision to ask different schools. So we didn't end up with our initial choice of schools. But despite this, we did achieve a wide range of perspectives, both in terms of the students and staff interviewed and the types of schools. And also it was a small sample, so obviously with qualitative interviewing, qualitative research, you'll always have a small sample, but it's more in depth. So actually going forward, it would be really interesting to look at these issues using quantitative methods, so looking at the numbers from your school surveys. So that would be really useful going forward. So really, I'd like to finish on looking at the implications of this study. So I think the main message is that the provision of support staff may play an important role in enhancing school health and wellbeing in secondary schools. Thank you for listening. Any questions?
Well, can I just thank you? That was really interesting. It was very interesting. And I think as you were talking, I was sort of reminded about a couple of other webinars that we've run. One was the last webinar, which is on the website. We're looking at the importance of relationships with staff and student health. And the sort of, looking at sort of maybe poor teacher well-being and then presenteeism or their performance at work. And I just wondered whether you had anything to say really in terms, it seems like this, you're saying that if we have the support staff and the teaching staff involved, that could be a sort of positive thing. Do you want to say anything about that?
I think that's really interesting. And obviously if the teacher's own well-being is low and their mental health is affected, then they're not then in a position to offer pupil support for well-being. So I think maybe having support staff in place may relieve the pressure from them and make them more able to have positive relationships with their students potentially.
I think just having numbers, isn't it? So that it's not one member of staff who's having to sort of be the one go-to sort of person. School, I think must be very positive. So I was going to ask if there are any other questions, because they literally flash onto my screen and flash out again. So I don't know if there are other things that anybody.
So someone's just asked if there's a link to the full paper.
Ah, right. Yeah. Well, yes. Well, one thing I was going to say was that we always write a research brief. We're going to be doing that shortly in the next, sort of few weeks. So that will be sent out. But we will certainly send out the slides. I've noticed a few people asking for those. So those we can send out
a link
straight
to the
away.
full paper alongside that.
Yes. So let's do that. And
accessible.
then, as I say, we do a research brief which just tries to get the sort of the real key messages, because we realise you're all so busy. So that just means that you can get some of the main points. I don't know if there's anything else you want to say. I mean, I think it was really interesting, and I think all of those ideas for future research do seem to sit very happily within the network, don't they? And the work that we're doing, because the other thing you mentioned was that concern over more support staff in areas maybe with sort of lower socioeconomic, but what happens to the young people in a school in a higher SES area, and perhaps with less support. So I think we've Graham Moore here did a webinar on that element, which I think we could so it's all sort of tying up really well. So I think as long as there's no more questions, I'm looking at Matt, who is busy typing. Can I just say thank you so much? And I know that you have a baby that you need to be attending, so she's just going to slip away now, but thank you so much. And we'll send all of that I'm just going to just take it on a little bit and just give a little bit of network news. It's the ideal opportunity while you're here. So I just want to say that we've sent out a student health and wellbeing reports usage survey, and we would really just encourage schools, if they could complete that. It should only take a maximum of 10 minutes. It's an electronic questionnaire, and it just tells us how you're using your student health and wellbeing report. We have had quite a few back, but the date we need them back is Friday the 22nd of February. So this just allows us to know whether and how schools have used their report, so we can monitor it and monitor change over time. It's very useful evidence for us, because to tell funders so that they keep funding us. Yeah, it is really valuable. And I know from our summer events and newsletters that the thing that school staff like more than anything else is to hear of how other schools are using their data. So there is a question at the end of the survey that just says, would you be happy to share your experiences of that? So I'm just going to encourage you to do that, so that we can sort of have a variety of different approaches represented at our events. So that was one. Another thing which you may or may not know, but is quite exciting. So our first publicly available national report based on this data will be released in the next couple of months, and so then we will have data at the school level, local authority level. So all of the schools know that your local authority have got reports. We did email out to you all, but if you missed that and you'd like to see a copy of that, then let us know. But what we have asked is to bring that to life. We'd really like students of network schools to get involved by sending in some pictures. And we thought on the topic of what does health and wellbeing mean at your school. So if you have, it'd be great to sort of ask your young people if they'd be happy to do that, so we can use them on the front cover and then in the body of the report as well. So there's a minimum screen resolution, which you will see on the slide. I'm not quite sure what that means. So, but if you'd like to get involved, we're thinking by the 1st of March, but just come, just ask us. But I think it would be really nice rather than sending out just a sort of plain report. And we have some young people who've written the foreword for that. Just the other thing, I know the summer events, we love meeting you, and I know you like the whole networking sort of opportunity that it brings. So we're doing the same 3 events across Wales. Those are the dates, and we'll be sharing practice. And I think what will be really useful is preparing for the survey, which in the autumn. So the 2-yearly survey is coming round again. It seems too quick, but it will be next autumn. And then just to remind you of the next webinar, which will be the last of the year, because we do webinars in the first 2 terms and then the events in the 3rd term, is due on Thursday the 28th of March. We will obviously send invitations out sort of, maybe from half term, and that's looking at trends in tobacco and e-cigarette use in young people. So we hope you can join us for that as well. So thank you for being with us, and we look forward to sort of working with you all as the time progresses. Okay, thank you. Okay.